Morning. My name is Wendy Beta. I live in the greater Seattle-Tacoma area and have recently completed my undergraduate program at the University of Phoenix. I work for a large organization here in the community called Multicare. I carry two positions. The first is that of a hospital supervisor, and the second is in the field of hospice palliative care. My personal and professional experiences have prepared me for the advanced practice role, and that I'm required to make critical decisions regarding potential diagnoses, processes, and determine appropriate placement within the hospital setting for best patient outcomes. In my professional and personal life, on a regular basis, I've developed the skills to prioritize assignments, also projects, and identify the needs versus necessities. I fine-tune the art of interpersonal skills and conversation with my family, my peers, and my patients, in particular in dealing with stressful situations that are emotionally charged and require me to push away my personal viewpoints, feelings in regards the situation and provide the support that is needed to the patient or her family, the staff, and indeed my own family when personal matters have arisen. The advanced practice degree will help me meet my career goals as I plan to pursue the field of hospice and palliative care for both the pediatric and adult patient. This is an area in particular that I feel sorely lacks the skill set and the unique skills that the advanced practice nurse could bring. Patients die every day in pain and with poor symptom management, and I feel that this is really unnecessary and that really doesn't need to happen. I believe my pursuit of my career goals align with the Georgetown University mission statement in that I do provide care from a holistic approach, meaning providing support for the patient's spiritual, emotional, and mental needs, and also meeting the patient where they live. What I mean by that is caring for the patient regardless of who they are, where they are in our community, where they physically live, mentally live, just providing the best possible support and care I can give. My greatest challenges in entering the program will be initially the adjustment and accommodation for my schedule and my assignments to meet the needs for study. I plan to meet these needs by planning ahead, front-loading assignments and my reading, utilizing resources that are available to me, keeping open and frequent communication with my peers, faculty, my fellow students, and my family. I feel that that would be the key to my success. I'd like to offer an example where I exemplified clinical skills in regards to interpersonal leadership and communication. This occurred about 2 nights ago, actually. We had a code blue. I took the lead and was able to monitor the patient status while giving direction and collaboration with my fellow team members. We worked closely with the physician, of course, and fellow nurses to resuscitate the patient, which was a success. After we resuscitated the patient, we debriefed to discuss what went well and identified what could have been improved. Once these issues were identified, we communicated these suggestions to the clinical area manager for follow-up. My life experiences that have shaped my path for my career here are significant to me in that I was very young. My mother was diagnosed with breast cancer, and I was her primary caregiver. So I appreciate and understand the difficulties that can come about for caring for a dying patient. I also have seen it from the professional side as well. I feel that there's a lack of education in regards to the comfort and the meeting the needs of the dying patient, adult and pediatrics, and hope to pursue this and provide support for my local healthcare community as well as the patients and their families. It's my desire to advocate and be a champion for change in the care of the dying adult and pediatric patient within my community. I would like to take this time also to express my appreciation for your time and consideration of my application for the advanced practice. Thank you.